So I want to welcome everyone to this discussion. We're hosting this conversation called Doing Our Part, Protecting Our Community During the Pandemic. We recognize that you have either arrived on campus or participating in your orientation and first term remotely, and that may not be or look the way that you maybe imagined. And certainly for us, it's a new way of engaging in community at Dartmouth and engaging in academic work at Dartmouth. When we invited you to campus, we asked that you sign a community expectations agreement. And that agreement is something that we have worked on as a community to express the values and expectations we hold for one another so that we can successfully be here at Dartmouth or participating remotely. We wanted to give a chance to talk about, like, how did that happen? How did we end up with these values? How are these values supporting our community? And what are the questions that often arise when people are faced with a new and challenging situation? In this case, the pandemic that we're all living through and working with. So I'm Katherine Strong. I'm the Director of Community Standards and Accountability at Dartmouth, and we've gathered these folks together to talk with you today from a couple different perspectives about how you can be successful in both engaging with those community expectations and engaging with your time at Dartmouth during the pandemic. I'd like to ask each of us to introduce ourselves, and maybe as we're introducing ourselves, we could include things like our pronouns, our role on campus, and then, you know, as you think about how you're adopting these new values, as you think about how you're going to work with these expectations, if you could talk about what your individual why is. Caitlin, you work over in wellness. I'm sure you can tell us like how that helps with habit formation, so I'll leave that to you. But I think if you can think about what is it that helps you to consider changing your behavior in the way that the expectations ask, that could be helpful for our students to see sort of how we're all having to consider how to integrate our values with the community values. So as I've already said, I'm Katherine Strong. I'm the Director of Community Standards and Accountability. My pronouns are she, her, and hers. And my why has to do with the fact that I have family that live across the country, and during this time, I can't travel to see them. And so when I'm committing to wearing my mask, when I'm committing to social distancing, when I'm working remotely, when I would much rather be in person with all of my colleagues and students, my why is I want to be able to connect with that family in a timely fashion. And so the more that we can keep our community healthy, the better I'll be able to travel and see those folks. Zeke, why don't you give yourself an introduction?
Oh, hi everyone, I'm Zeke. I'm a 21 calling in from Miami, Florida. I am a student on Dean Lively's Student Advisory Board. And I guess my reason for following and participating in the community expectations is just so that I can be back on campus in the wintertime and see friends that I haven't seen in some of them for over a year. So I'm really looking forward to that, and that's why I wear my mask, social distance, and follow all the guidelines. So Mike, I would love to hear what your reasons for following the community expectations are.
Thanks, Zeke. My name is Mike Wooten. I serve as an associate dean here at the college. I work with residential life. I work with our multicultural office, Opal. And it is great to be on this call with all these amazing colleagues. My commitment and my why is professionally is that my job is much more interesting when you're on campus. So I would prefer to have you here, and that's going to take all of us doing this together to keep this thing moving, right? And on a personal level, my partner works in the local schools, and I would like her to be safe, and I would like her to also be able to work with her students in the local schools, and that's going to take all of us doing our best to keep this place safe. How about Anna? Can I pass it on to you?
Sure. Hi, my name is Anna Hall, and I use she, her, hers pronouns. I am the Director of Student Involvement, and our office works really closely to support close to 200 student organizations and facilitates many of our large-scale programs on campus. And so my why is really just that I'm hopeful that by supporting each other and the new expectations now, it will allow us to do more and achieve some normalcy, whatever that may mean, soon. So Caitlin.
Hi everyone, I'm Caitlin Barthelmess, she, her, hers, and I'm the director of the Student Wellness Center. And I'm actually calling from my office because I was helping with the testing tent this morning. And I bring that up because it's one of the only times I've been on campus. I think it was one other time to help with move-in. And so my why for doing things like avoiding the office, even though I really want to be here, is because this pandemic has really, for me, had me realize how interconnected we all are as humans on a even global level. So when I decide to even do small things, even though they're hard, like not hug a friend when I haven't seen them for a while, or wear a mask when it's really hot outside. Those things are hard, but I realize that they have a ripple effect, not just on the people who are closest to me, but on the community, the region, the world. And for me, that's just been kind of really empowering. And Mark, over to you.
Hello there, my name is Mark Reed. I'm the director of the health service. I use he, him, his. And for me, I've been here a long time. Came here in '87 to do my residency at Dartmouth Hitchcock Medical Center. And, you know, this is a place that I care about and love. And it has been, frankly, strange over the last 5, 6, 7 months that we've been interacting with each other mostly like this. And I am very excited, you know, to see the students moving in, going through the testing tent. Everybody really wants to bring this community back. And I want to do everything I can to help make that happen.
Thanks, everyone. We wanted to recognize that, you know, adopting new behaviors, adopting new values is a challenge. We came with expectations. All of us come to our work and our academic work with expectations, and having to shift those so that we can be together and be healthy in a different way is challenging. And so we don't want to pretend that this is not a hard thing to do. It has been a shift, I feel like, sometimes every day, sometimes every month, just in my own life, about how we're going to continue to interact to keep our health at the forefront, but also to make sure that we're maintaining those relationships and engaging with one another. So we have a couple questions that have come up that we wanted to utilize the wonderful people here to kind of talk about the answers and engage in conversation. So I'm going to start off by asking, Dr. Reed, how will the college's guidelines help to support all of our health? How is that going to happen?
So anytime you add density or more people to an area, it increases risk. And so there is an inherent increase in risk by welcoming students, staff, and faculty back to campus. And we have been planning for the last 5 months about how we can do that in a responsible, relatively safe way, and to increase the chances of us doing a successful job at that. One of the things that excites me is there aren't too many opportunities in life where we know that we can make an impact. And it is absolutely true that each one of us plays a critical role in making this thing work this fall. And so the first 14 days are super critical. That's why we're doing pre-arrival testing. We expect to get some positives, and we have. And we're supporting those students, and then we're going to welcome back to campus. We're doing arrival testing, and we expect some positives, and we've had a couple. We're supporting those students. And then we're going to do surveillance testing through the term. In addition to that, the students, staff, and faculty, we all need to do our very best to physically distance, wear our masks, and wash our hands. If we do that, at the end of 2 weeks, we will have a really solid foundation from which to build. We'll still have to have restrictions on travel and stuff like that, because anytime you add somebody new, there's a little bit of a risk. But we can put ourselves in a great spot after the first couple of weeks.
And I just want to chime in, if that's okay, that we've said it a few times, these guidelines are really hard. But we also know that they're founded in public health best practices and are founded on what we know of the virus thus far, at least. And so I think it's really hopeful that if people really take this seriously and we all do our part together, that we have a chance of operating in a community with no or low community transmission. And that just means that we actually could potentially continue to live and learn together physically on campus. So.
And I know, as we've talked in preparation for this conversation, you know, we're confident that we're able to do this. We're confident our students can follow these guidelines. It takes all of us to engage in that work. But we want to engage with students in a way that's meaningful for them, but also in a way that supports the health of the community. And we think those things can go hand in hand. Caitlin, I'd love to follow up with you if I can. So why do masks matter if I'm quarantined or if I've tested and I've gotten back a negative result? And what about wearing masks if I'm outside?
Yeah. So all of these things kind of interplay together. So I'm not surprised that question comes up. I think the primary answer is that we know COVID-19 primarily spreads through respiratory droplets. And what the face coverings do is they act as a simple barrier to help prevent those respiratory droplets from spreading from the person who's wearing the mask and traveling to land near or on someone else. And so that's particularly helpful when the person wearing the mask, for instance, if they're coughing, sneezing, but also when they're just talking, raising their voice, singing, right? That these droplets can kind of travel farther than we think. And so research has found that wearing the face coverings reduces the spread of COVID-19, particularly when it's used universally within a community. So what that means is if we're all doing this together, then they're much more effective.
I guess piggybacking on that, Caitlin, if you have these respiratory droplets in a room and you enter without a mask, you can still have residual droplets that are still in the room once you enter. So it's crucial to wear a mask even if you're in an empty room, or even someone could just pop in if you think you're alone, but you're actually not. So you can also leave the droplets in the space that you were in if you're not wearing a mask. So it's crucial for everyone to be wearing one, just to keep yourself safe and also to keep others safe.
Yeah, and to kind of go back to the question about the outdoor setting, right? I think that's really an important one to address, because it is less likely, it's not trapped in an outdoor setting. But what we do know is that even in outdoor settings, the respiratory droplets are still traveling at least 6 feet. And so when we can't be that distance from people, like for instance, if we're in busy outdoor places like the green or downtown, or even just walking on a sidewalk around campus, the chances that we might unexpectedly be near someone passing by or seeing someone we know really warrants us wearing the face masks even in those settings. In the situation where perhaps you're in a more remote location, it's still important to have the face mask so readily available that as soon as you have someone in eyesight, you're popping that on. It's just the right thing to do to prevent the transmission from one person to another.
And I have a question for you all. I know that some of my friends have been asking, what about exercise outside or just exercise in general?
So that's a great question. I would say when in doubt, wear a mask even while exercising outside or going for a solo walk. The reason for this is that the lines between college property and the town of Hanover are murky and confusing. A solo walk in Hanover is not really a solo walk. The town of Hanover has passed an ordinance requiring that masks be worn in public spaces. Similarly, the college requires that masks are worn when it is not possible to physically distance. In addition, the Upper Valley community is also very conscious about face covering. So for example, while hiking, many people often have a mask on or always have it easily accessible just in case. There also may be specific recommendations for certain sports that will be shared with you if you partake in those activities. But the general expectation while exercising is to stay well over 6 feet from others and wear a mask.
Thank you for that. I guess it does make sense because when we're outside, we can definitely interact with vulnerable populations, and it's important to keep them safe, especially if you're walking on the green or something like that. You could definitely interact with a vulnerable individual. And it's also that many Hanover residents frequent these green spaces like the green, so it's definitely important to keep them safe as well.
Yeah, I think a question that comes up off of this part of this discussion is, what do I do if I see someone not wearing a mask? And what if someone speaks to me about not wearing a mask? And so Zeke, you have experience interacting with your peers on campus. Can you talk a little bit about what that might look like?
Yeah, I think the biggest thing is being kind to one another, because this is an adjustment for everyone, both students, community members, faculty. So anxieties are high because of the pandemic and just adjusting to the new normal. So be kind if you see someone not wearing a mask, and just approach them and ask them to put it on. I can say from my own experience that there have been times where I forget my mask, and then I quickly realize, and all I need is a reminder to go get it. But we're all adjusting to this, so it's important to just have grace with one another and be kind.
Yeah, and I really appreciate that idea of approaching people in a way that sort of gives them the benefit of the doubt. Because I think what that does is it transforms what could be confrontations into just conversations, right? So if we see friends, we could say things like, hey, Mike, notice you don't have your mask on. What's up with that, right? Like, oopsie doopsie. Mind putting it on, right? Or, kind of on a more serious note, I think we opened talking about our whys. And I think when you're able to make a request that's associated with why it's important to you, that can also help people understand and maybe be more motivated to comply. So, for instance, hey, I know it's really tough to keep our face coverings on all the time, but I have a friend who's high risk for getting COVID. And so I really keep her in mind whenever it's kind of tricky. Mind putting yours on for other people who are in similar situations, right? And so if we can really just make these friendly reminders and sharing our why with each other a normal part of our conversation, what it does is it kind of creates a dialogue on campus in which it's setting the standard that that's just what we do here. We just remind each other, we just nicely ask, and we comply.
I will commit to all of you that I will wear my mask on campus all the time. I want to talk a little bit with you, Mike, about some experiences in the residence halls. I know that students are either have been in quarantine, the big incoming quarantine, or remain, in their residential spaces, but they're likely meeting people and making new friends. Can you talk a little bit about, like, if a friend wants to visit another student in a room, what should they tell them? How should they navigate those conversations?
Let me say, first of all, that, where you live, we're trying to really prioritize this, the well-being and the safety of your residential community. We know that where you sleep and where you at times eat and in a normal time where you really interact in such personal ways with so many people, we just really think that it's of the utmost importance for us to keep our residence halls safe for all of our students. So that has meant, of course, during a virus like this, that we have all sorts of new guidelines and requirements of living in community. So one you'll notice right away is that you will not be allowed into other residence halls. So your card access will only allow you into your residence hall. We think that matters in helping to create safety in our communities. And in your rooms, if you have the ability to distance with 6 feet, you will in fact be able to have a guest, but you would have to be able to distance with 6 feet and keep your masks on. But that would be the only exception of having a guest in your room. So at Dartmouth, the guest policy has meant different things when we're not in a pandemic. At this time in the residence halls, this is what it means, that you only have access to your building, the building that you live in. You can interact with members of your community in that space, so in your building, of course. So if someone else lives in your residence hall, you can interact with them following the guidance that is posted in lounges and public spaces in that building itself. And in your room, if you're able to distance appropriately, you can have a guest from that community, but not from outside of your residence hall.
Mike, I have a question on that. You probably know better than anyone else that Dartmouth has a very welcoming community, and we like having people over. So I was wondering, can you expand on what building students will have access to?
Yeah, so this is actually sort of a work in progress, and as Mark and myself and other members of some of the core groups at the college who are looking at what is both the capacity of our spaces across campus, so all of our physical plant. So there are some buildings that we know will be open after quarantine. So the library will be a building like that. A portion of 53 Commons. There will be tents set up all over campus where people can gather. The residence halls, of course, the house centers will be open. Collis and Robinson, hopefully with the right guidance, will also be open post-quarantine. And that list is going to change as we move into the week 3 through 9 of you being on campus, as we both figure out how it's going with the virus on campus and what is the capacity of our spaces in light of what we're learning from the community's lived experience on campus.
Mike, I think you've hit on a really important point there, which is that we're continuing to work as a community to figure out what the next right thing is for the community. That it's important for us all to remain informed on if there is a change in expectation, if there's a broadening of access to things, if there's a constriction on access to things, because that's how we're going to maintain the health of our community once we've sort of gotten through this first couple weeks. So I think that's a really key thing, is that there may be changes, and to be ready to kind of engage with those changes and understand how they may impact your own experience.
Yeah, absolutely. And let me add something there. As late as the day before you arrived, you received a communication that gave new guidance for the day, that the next day which you were being tested and welcomed back to the residence halls. We know, because we hear this from many of you, that reading your emails in a prompt way is sometimes a challenge. In fact, maybe that shows how maybe I'm a dinosaur and you're on 8 other platforms communicating with each other. With that said, it's going to be really critical that you follow the latest messaging and communication that will often come to you in an email as things are pivoting and changing throughout the term. So please read what we send you. Please be in communication with us if you have questions, because as you learned, even with the arrival to campus, there were things that we were communicating the day before you came. And that was really to give you the most up-to-date, the promptest sort of set of expectations and questions answered for a smooth arrival to campus. And I'll tell you, it's been a relatively smooth arrival to campus. And so we're very grateful that the vast majority of you have been all over those communications, and you've done a really wonderful job of following the guidance at the college, from the testing tent to getting your ID, your wristband, your orientation packet, to coming to the residence halls. Your parents have been absolutely amazing. You've been amazing. You brought a little bit more than I asked you to bring, but you're in your rooms, and we're so glad you're here. So thank you for doing, even up until now, the right thing, which is to read what we're sending you and following the guidance.
If I can ask you one more question while I have you. One of the things that we've learned over perhaps only the last 7 months is that things can change, right? Yep. And so what if a student needs to go home or has to travel due to a family circumstance or an emergency? What happens, or what should they do?
Yeah, so listen, we have been working. That's a great question. And I can imagine the anxiety that could bring up in all of us, this notion that you're sort of trapped somewhere and that will be no exceptions for you. It feels a lot like that as you read all the guidance that we have for you to be on our campus right now. Please know that we are in the business of working with you as individuals as well. And so many of you will have the need to reach out to a dean or to someone on this call, or a faculty member or a staff member that you've learned to trust, or you've just seen their face and you want to ask them a question in the next few months. And we will work very, very carefully with you on what are the needs that you have back home and on this campus. And we're already doing that. We'll continue to do that. The important piece is you need to ask. So for us to know how you're doing, you're going to have to reach out to someone. That's on you, right? You're going to have to let us know. We have a lot of people who are trying to keep eyes on you. We have UGAs and OPLs. We have staff members that are interacting with you in all these interesting, strange ways on screens and sometimes outside. But you also need to tell us if you need something. And so that's going to be really critical so that we can work with you on your individual needs as we move through this together.
Caitlin, I'm wondering if you can talk a little bit about what happens if I don't follow the guidelines.
Sure. I think the way that I can answer that is the first pass is what I call a community intervention, right? So we are all being called to be proactive, positive bystanders in this moment and always. And so what that means, going back to what we were talking about earlier, is if you see someone who's not complying with the guidelines, you can tap into what we call the Dartmouth bystander intervention skills. And you can either do something yourself, kind of go up and speak with them and request they comply with whatever piece of the agreement that maybe they're not in that moment complying with, with compassion and kindness. And then also you could bring others in. So if that's not something that you're comfortable with, perhaps you can find someone nearby or a friend to either go with you to engage in that conversation, or you could ask them to do it for you. And then the last piece is we call ingenious alternatives. And so what could you do that still signals to the person that reminder to comply? Like if it's a face covering, you can maybe just point. You don't even have to approach them, and that may be sufficient. So kind of, again, trying to think of ways to, at first, get folks to recognize that following these guidelines are important to all of us in living and learning together. And then I would say, following up on that, if somebody's asking you to comply with the guidelines, that it's helpful to remember it probably is really nerve-wracking for that person to come up and speak with you. And so to me, that's a signal of how important it is for them to actually kind of get over that barrier and engage with you. And so if you can keep in mind that it's not an assault on your character or your decisions, but rather it's almost an anxious plea to kind of keep in mind that we all need to do our part in keeping other folks safe. I think hearing that request with that same compassion and kindness that you're hoping they're expressing it in will really kind of help that first level of sort of compliance more likely to occur.
And Caitlin, I agree. I definitely agree with you. I think that most students, all they need is a gentle reminder. We're all really nervous about following these guidelines, and really all we need is a kind, gentle reminder, some grace. And I feel like most people do want to wear their masks and follow the rules.
Yeah, I think those are really important things to consider, that a direct interaction is going to have the best impact, right? And if we can understand that people may be more likely to directly interact with us because of the situation we're in, because of the pandemic and the need to maintain the health of the community, we can also set ourselves up to understand, like, a stranger may tell me I'm not wearing a mask, and I need to be ready to respond to that in the spirit that it's being given. I do want to say in our work, there are other things that you can do if an interaction doesn't go well, or if you just, it's something that you're seeing and you don't know how to address it. It's something that you just don't have time to address. A lot of you have probably downloaded the Live Safe app that security uses, and you're welcome to report things that you have concerns about, particularly immediate concerns, through that Live Safe app, to let people know, like, this is something I'm seeing and I think it may need to be addressed. We also have a report a concern form available, and it's linked in a variety of places on the website. We'll put it up on the slides as well. But what that does is give you an opportunity to let us know something you're seeing. Maybe you're not sure if it's within the keeping in the spirit of the guidelines. Maybe you're just seeing it every day and you're wondering if it's a habit that's formed. We have a team of folks who are reviewing those things and reaching out both to the people that folks are concerned about, but also to the reporters to kind of check in with them and see how things are going. One of the things the community expectations is really clear about is that we will be responding, quickly so that we can maintain the health of our community, but also, based on the information we have available. And so we're taking into account, what is possibly a misunderstanding, what is possibly a real action that is harmful to the community, and how can we sort of differentiate the response to those things. So I encourage you to use that form if you feel like you need to. One of the things I talk about with folks when they ask about reporting is we all have a different level at which we feel like something is important, and you just need to pay attention to that individual level for you. At the point where it tips over to feeling like you need help, getting the attention of security, putting in that report a concern form, talking with your UGA, any of those things are ways for you to address issues that arise in the community. And just pay attention to that inner voice that says, like, this is outside of my wheelhouse. I need some help in order to address this. That's fine. We'll figure out the best way to do it. Mark?
A little detail about the Live Safe app. You can use your name, or you can also report anonymously. But I think the key thing is to do it in a timely manner. So if there is something that needs to be responded to, people can do that right away.
Zeke, I know you've had different experiences on campus, right? You weren't quarantined and living under a pandemic for the first couple of years you were here. But you also may understand, like, how can folks meet one another? How can they connect in this situation, but also generally at Dartmouth? How does that happen for students, and how might new students on campus engage in those behaviors?
Yeah, I definitely think it'll be different with the pandemic and with a lot of things being virtual, but I do think that a lot of the same tricks and whatnot still work. I think that it's an adjustment for everyone, both as a first year and then as a first year in a pandemic. So I think the big thing is staying connected to those with whom you've connected. So using Zoom, FaceTime, GroupMe, whatever it may be. And I think that it's a good time, especially during the quarantine period, to stay connected with your first year floor, with your orientation group. I think that in my own experience, my best friends, some of them have come from my first year floor and from people I met during orientation. So I would definitely say be open to connecting with people and stay in contact with your peers. And I also think that once the quarantine period is over and small gatherings are allowed, I think it's a great time to go outside and enjoy the pristine outdoors that Dartmouth has. It'll soon get cold, so definitely taking advantage of it as it comes, especially in September and early October.
And I'll jump in here. One of the best ways to connect with others is to get involved. And there are so many different ways to do this at Dartmouth, some of which include joining a student organization, participating in student government, taking part in a leadership program, or working on campus. Now, involvement will look a little different this year, and student organization events and activities will have new parameters to follow. However, it's still a great way to make friends, connect with others who share similar interests, discover new and exciting ways to make an impact in the community, and also to just have fun. While participating in student organizations is a really integral part of the Dartmouth experience, it also comes with an expectation of responsibility and accountability for creating a positive, inclusive, and meaningful experience for all students. One of the best ways to learn about student organizations will be the Student Involvement Fair tomorrow, where you can virtually meet student leaders from many groups on campus. But there will also be opportunities throughout the term to hear from other campus partners and student groups about getting involved.
And I'll just offer, as the wellness director, that I think you could really take advantage of this slower pace and kind of alone time. It's a very untraditional start of the term, but it could actually reap a lot of real benefits. You could think about your past and reflect on that, really kind of think about the future and what you're hoping to get out of Dartmouth and your time here. And you could try out some new self-care practices, right? When you have this kind of dedicated space to yourself. And so we don't always get that opportunity, especially in the fast-paced campus life that we typically have. And so I kind of think it could be a really exciting start to start a term off on that kind of a stronger note.
Yeah, I think one of the things I've noticed and heard from folks is that they're using these first couple of weeks to really establish their routine for how they're going to interact with their academic work, how they're going to sort of self-regulate when they eat, when they sleep. And all of those things are on a learning curve whenever we change our environment, let alone come to school. And so this could be a really good time to sort of establish those routines and habits. And then as you're connecting with people, integrate those together rather than having sort of disparate experiences around that. So that's really cool. I want to thank all of you for joining us in this conversation. I feel so much clarity. Thank you so much. But before I close, I just wanted to check in with folks. Does anyone have anything they want to add or anything we didn't get to that they feel like would be a really important thing for students to consider?
You know, you'll hear us talk a lot about community in the next, you've heard it before you arrived. You'll hear it as we move through this. You're hearing us say that we need to do this together. The only way this is going to work is if we do this together. Let me also say that there's a unique opportunity for you this year at this time to start things, to co-create moments with your peers, with faculty, with staff that we never would have imagined in a pre-pandemic world. you have some opportunities that your peers who came before you never would have been forced to think about. So I would ask you to embrace that. That sounds Pollyanna-ish, but embrace it. Help us make a better Dartmouth together. And I think this moment has some unique opportunities for that. So I'm just so excited to see how that's going to go with you as a class.
If you find that you need accommodations in order to comply with the community expectations, please be in touch with our Student Accessibility Services office. Their contact info is on the slide. So you may have questions that have come up for you while you've listened to us kind of talk through the community expectations and how we're going to join in creating community together during this pandemic. To submit questions, please go to www.dartgo.org/doing-our-part. We'll be reviewing your questions and seeing what themes come out and how we can best address those together. But I really do want to welcome you to Dartmouth. I want to thank you for your patience with everything that's going on. I think you all have shown just an extreme amount of resilience, and we're real excited you're here. It's a different feeling, but it's a great feeling, and so thank you so much. I want to comment that this presentation is based on what is true at the time that we're doing it. And so again, just want to stress, keep abreast of things that might be changing, keep an eye on your email, be up to date on what sort of the expectations are around the community. We are presenting to you the best information we have right now. And so we recognize things may change, and we'll come back and talk to you about it if they do. On behalf of Dr. Reed, Zeke, Anna, Mike, and Caitlin, thank you so much for joining us. Welcome to Dartmouth. We hope you're having a good weekend.